I'm a pharmacist. Don't take this medication and take these medications instead. I know you're all gonna come after me in the comments, but one of the medications that I do not like at all is NyQuil. Let's break down what's actually in NyQuil. I don't always use this medication for like cold, flu, and sleep, but like with this medication, there are probably ingredients in it that you do not need. First being acetaminophen, 650 milligrams per dose. This dose is the same as like 2 regular strength. Now, I don't know about you, but most of the patients who I speak to usually take the 500 milligram, which is an extra strength, and they take 2 of them. So you're not even getting really like the full amount of Tylenol that most people take. And if you have more than a fever, the acetaminophen isn't really gonna do much. So instead, my alternatives that I recommend is either naproxen, which is the generic for Aleve, or you could take like Advil, which is the brand for ibuprofen. These work much better, especially like aches, pain, and then also like inflammation. Now, if you have high blood pressure or any heart conditions, you probably will have to take Tylenol or acetaminophen, which I don't have. Next is dextromethorphan for a dry cough, which is just the 30 milligrams. Which I will say usually for dry coughs, like at night, I usually prefer like a dextromethorphan that's like 12 hours, which you could literally just get like this or Delsum. Usually the dosing in adults is 60 milligrams every 12 hours. If you want to go the more natural route, you could do honey. Just make sure that it's for children over 1 year old. Or you could also use like Zarbee's. Honestly, like I use this because it just tastes really good. The last ingredient for this is doxalamine, 12.5 milligrams. Now for adults, this is actually half the dose of what's actually recommended to sleep. And it may help with allergy symptoms as well. Honestly, if really the only concern you have is trouble sleeping, I would just get it on its own. Or you could just get like over-the-counter Benadryl or diphenhydramine, which before you all yell at me, you only want to use this like as needed. So like if you take like 1 dose a year, it's not going to be the end of the world. If you're trying to save money and just treat the symptoms that you have, stay away from this.